Taoiseach, I assume everybody in the House would want to congratulate the WRC and indeed the INMO on coming up with a resolution that has seen the threatened industrial action in our A&E departments deferred today. But unfortunately, a consequence of the very late resolution of the problem was that hundreds of patients across the country have had their elective procedures deferred, and they will go on now to join the thousands of people already on waiting lists. And I think, Taoiseach, this is shoddy, to say the least, insofar as the union gave very considerable notice that it intended taking this industrial action, and unfortunately it wasn't until the last minute that compromise was arrived at. And in fact, I think it has to be said that the government has a habit of allowing situations become totally chaotic before they take action. To add insult to injury, we learned today from the Irish Times that there is already identifiable within the service plan for 2016 a shortfall of €100 million, which will inevitably result in thousands of people failing to be treated in hospitals up and down the length of the country, and the government failing to see these people meet the targets that have been set down by Minister Varadkar of 15 months for adults and 20 weeks for children. So I think it has to be accepted, Taoiseach, that the government has not been honest in its health budgeting over the last 5 years. They have set targets knowing that they could not be met. The waiting lists and waiting times have got longer, and overcrowding in emergency departments has gone from crisis to chaos.
Question, please.
Minister Varadkar is saying that next year's budget will maintain existing levels of service. Well, we all know what that means. But very interestingly, over the weekend, the CEO of the HSE, Mr Tony O'Brien, said that the health service has been on death row since 2011 and that there is no money, no plan and no vision. So can I ask you, Taoiseach, do you agree with Mr O'Brien when he says that there is no plan, no money, no vision? And does Minister Varadkar, when he says that he concurs with many of the valid points which Mr O'Brien has made, some of which he has made himself?
Thank you.
Is he referring to this key element of the lack of vision, the lack of money and the lack of a plan?
Taoiseach.
Well, I'm glad I'm glad that the INMO have reached an agreement with HSE management to call off the strike. As was pointed out by the Minister for Health on a number of occasions, strike action would not deal with any single person on any trolley anywhere, and it wasn't the government that called off that called the strike in the first place. And I'm glad, as I say, that the negotiations have resulted in the strike not taking place. I would point out to Deputy Ó Fearghaíl that the number on trolleys this morning at 8 a.m. was 290, which is down 33% on this day last year. Still too many, but very much down. Clearly, the government recognise, Ceann Comhairle, that working in emergency departments can be a very trying, difficult job, and that recruiting and retaining staff is always a challenge. I hope that the nurses and the unions will vote in favour of the package agreed at the Workplace Relations Commission, and that the planned action for Tuesday the 12th and Wednesday the 13th of January will not arise. It's very unfortunate that this planned action resulted in the deferral of elective procedures in the hospitals concerned, and those people who are waiting to undergo procedures today obviously now have to go back and have a return through the process again. I don't accept at all that there isn't money being put into the health service plan. Over 13 billion, an increase of over 800 million this year. And I'd point out to you, Deputy Ó Fearghaíl, the service plan will be published tomorrow, and obviously the Minister's made it perfectly clear that there is no diminution in any service, and that there are targeted increase in service in a number of areas, and that's for the good of the patient, for the benefit of the health service in general. I would point out clearly that the question of of work practices is always an issue in hospitals, and clearly the discussions surrounding that are one of concern always for nurses who work at the front line, doctors and management. But the answer to your question is that there is more money in there than before. There is no requirement for any diminution in service, but rather maintaining those and targeted increases in a number of areas. Obviously, the longer-term vision here is to end the two-tier system, to have a single-tier system accessible to everybody based on their medical requirements as distinct from their income.
Deputy Ó Fearghaíl.
Taoiseach, you had a plan in 2007 to get rid of trolleys. You had a plan and made a promise to introduce universal health insurance, and that was abandoned last month by the government. You got rid of the National Treatment Purchases Fund when it was working effectively. You've agreed a plan now to deal with the situation in the emergency departments, and it's patently obvious that that's going to add to those waiting for elective procedures. There's 16,000 people waiting for colonoscopies across the country, and 3,700 are waiting more than 6 months. Now, that's obviously a totally unacceptable situation. But when the CEO of your health executive came out at the weekend and said there was no plan, no vision, no money in the context of the sort of multi-annual budgeting that the National Health Service has in Britain, but that he does not have here. That is an appalling indictment of the health service that you and your government are operating. So would you accept, Taoiseach, because way back in 2013 we were briefed that you yourself were going to take charge of the health service. You were going to grab it by the scruff of the neck. Would you accept, in fact, Taoiseach, that your two ministers for health and your government have in fact failed the Irish people, and that you have in fact been an abject failure when it comes to delivering for the Irish people the calibre of service that they require?
No, I don't accept that. I don't accept that at all, Deputy Ó Fearghaíl. And coming from the party that you represent, it's meaningless. Meaningless. Yes, you had a plan, and the plan still is to. The plan still, Deputy, is to abolish an unfair two-tier system and provide a system of universal health care to be funded by a particular model of universal health insurance. We had a plan to establish hospital groups. We've established those. We had a plan to put primary care centres in situ. There are 46 more centres around the country than in 2011. We had a plan to provide under 6s with free GP cards. That's implemented. Had a plan to provide over 70s with free GP cards, and that's being implemented. And the next step is to introduce cards for under 12s. We had a plan to increase staff in our health service. Almost 300 additional consultants have been appointed since 2011. Since January this year, more than 750 nurses, 250 more non-consultant hospital doctors. That's part of the plan as well.
Thank you.
We had a plan to put money into the mental health service, where you never bothered with it at all. We trebled the mental health funding and provided a suicide prevention strategy to reduce suicide by 10% by 2020. We stabilised the private health insurance. And I would say that obviously what you engaged in before in putting the HSE together on top of all the health boards was described by the Chief Executive as an amorphous blob. An amorphous blob, Deputy Ó Fearghaíl. That's what you did.
Thank you.
Our plan is to abolish the health service executive. Yes, but you know that what we want to do is provide a single-tier universal health care system. To do that, you have to put all these foundations into place, and that always takes time in the health service, as you're well aware. I disagree with you entirely. There's over 13,000 million going into the health area for 2016. That's 880 million more than last year, and it means, Deputy Ó Fearghaíl, despite your comments, that this will maintain services and will provide increased services in a targeted number of areas.